So just to be somewhat timely, I'm going to go ahead and get started with the intro, and that'll give people a little bit more time to come in and join us. But first, the intro. So welcome to another Women's Wellbeing Lecture Series, funded by the Rosemary Bowes Women's Mental Health Fund. I'm Lee Frame, the Associate Director of the GW Resiliency and Wellbeing Center. Today we have two lecturers, Doctors Aimee Danielson and Lisa Catapano. Aimee Danielson, PhD, is the founder and director of the Women's Mental Health Program at MedStar Georgetown University Hospital. She's a clinical psychologist and associate professor of psychiatry and obstetrics and gynecology in the Georgetown School of Medicine. She's worked exclusively in the field of perinatal mental health since creating her own postdoctoral fellowship in this area in 2002. Since that time, she's developed and implemented numerous clinical, academic, and research programs to respond to the unmet mental health needs of perinatal women. She leads numerous efforts to train medical providers, residents, students, and nurses on screening for perinatal mental health disorders and has successfully implemented universal maternal depression screening across MedStar. Dr. Danielson is a founding member of the DC Metro Perinatal Mental Health Collaborative and an active member of several local maternal mental health initiatives. Over the past several years, she has led numerous efforts centrally focused on expanding perinatal mental health services in the District of Columbia. Most recently, I'm really losing it now. Most recently, this work has focused on the integration of mental health care into the obstetric setting at MedStar Washington Hospital Center as the part of the Safe Babies, Safe Moms initiative. That's just one of our speakers. Our other speaker is Lisa Catapano. She's an associate professor of psychiatry and behavioral health sciences at the George Washington University. Dr. Catapano graduated from Harvard Medical School in 2003 with her MD PhD in neurobiology. She trained in psychiatry at George Washington and completed a fellowship in clinical research at the National Institute of Mental Health, or NIMH. In her current practices, she specializes in mood disorders in women related to infertility, pregnancy, and the postpartum period. In 2011, she co-founded the 5 Trimesters Clinic to provide low-fee perinatal mental health care for patients and to train residents in perinatal psychiatry. In 2013, she was elected to the prestigious American College of Psychiatrists, and in 2017 was honored with the American Psychological Association, or the APA, Irma Bland Award for Excellence in Resident Education. She's currently a member of the National Task Force on Women's Mental Health and a board member of the DC Perinatal Mental Health Consortium. She edited the recently published APA textbook on women's reproductive mental health, the first major textbook in this field. Dr. Catapano also serves as the GW Women's Wellbeing Champion in the Resiliency and Wellbeing Center and has played an important role in the development of this lecture series. Now she will join Dr. Danielson in giving this talk on balancing motherhood in the face of the pandemic. So with that, I will turn it over to both of you with thanks.
Thank you so much. I think I'm going to get us started today, but I know Lisa and I are both super grateful for getting the opportunity to come and talk on this topic. Being mothers and being clinicians that have worked with mothers for the last 2 years through the pandemic, both she and I have a lot to say. Having said that, and I actually can't see any faces on my screen, so I'm, hang on, there we go. So I'm imagining you all out there. All I can see are my slides. So a few weeks ago, Lisa and I met to figure out what we wanted to say today. And after that, I sat down to try to draft out some slides for this talk today. And I had a couple of hours to try to get some preliminary slides and thoughts on the page. And after 2 hours of toggling between tabs, this is what I was looking at. The sort of first PowerPoint slide with nothing on it. And I realized in that moment that, like many of the women I know, many of the mothers I know, my brain was still broken from the pandemic. I'm still easily distracted, at times unfocused, at times overwhelmed. And here I was starting to write a talk about mothering in the pandemic, and I'd really lost the plot of the task. Still probably grappling with my own effects from mothering and working in this pandemic. And so in case you're wondering, pandemic brain is a thing. It's also been called in the media as the fog of forgetting, is what a lot of people are talking about, which is just quite simply the negative effects and impacts on our memory, on our concentration, on decision making, on our ability to attend to things from this chronic and compounding, cascading stress and disruption to life that we've all experienced. And we're going to talk more about this later when we talk about the impact of this long COVID winter on our health and mental health. This is one of my favorite photos that I came across in looking at lots and lots of coverage. And I'm going to do a little bit of toggling with media right now, and it's a little clunky. America's mothers are in crisis. Is anyone listening to them? In December of 2020, a New York Times journalist wanted to give American mothers a place to be heard. They opened a phone line called the Primal Scream. Readers were invited to call in and leave a message with anything they wanted to say, anything they wanted to get off their chest, to vent. And many mothers called in. And I'm going to play you a clip from that line now.
Welcome to the New York Times Primal Scream line, where the floor is yours to yell, laugh, cry, or vent for a solid minute.
I just wanted to say,
I'm so sick of my goddamn kids.
this pandemic has made me realize that maybe I'm not cut out to be a mother.
I am doing my 6th load of laundry today.
Oh, God, every day I think I can't do this again. But then I do. I get it. I get up and I do it because that's just what parents do, right?
All right. About through the process of getting ready for this talk, I did some quick Googling about, and it came up with literally thousands of articles with these kind of headlines. Moms are not okay. Pandemic triples anxiety and depression symptoms in new mothers. COVID parenting has passed the point of absurdity. Working moms are not okay. And I guess I should have begun with actually, I'm going to go back, if I can, to this image here, where you see this mother doing the very best she can with an office in her closet, entertaining her maybe 3-year-old with crayons and a drawing pad as her 3-year-old's making her closet bar, a monkey bar, while she's trying to multitask times about 100 here. And this is what it looked like the last 2 years, for especially the first part of the pandemic, for many mothers, and for many working mothers in particular. About a year later, actually, after this New York Times Primal Scream line came out, so this was at the middle of January, so just a few months ago, a group of about 20 mothers in Boston met outside a local high school. And they didn't do it to socialize or drink a glass of wine or even really share COVID tips. They were there for one reason only: to stand in a circle, socially distanced, and scream. And so I ask you all, those that are listening in today, how many mothers in this audience have felt like screaming since March of 2020? And so when mothers feel there's no more appealing way to spend an evening than to yell into the frigid January darkness, and this was just a couple of months ago, beginning of this year, parents in the United States have been living through a universally terrible moment. For 2 years, we've spent each and every day navigating an ever-changing virus that's threatening our well-being, that's threatening the well-being of our children and our livelihoods. And the situation really reached a fever pitch during that January Omicron wave, at a time when we were really expected to start functioning normally, even though our lives were hardly normal. Now, some parents have weathered things worse than others. With different access to support and different senses of what's best for our kids, different convictions about masks and social distancing and vaccines. But the burden has fallen on all of us, and our mental health is really taking a serious hit. There's a nationwide survey going on right now by a sociologist at Indiana University, and she found so far that 70% of mothers and 54% of fathers are feeling overwhelmed and stressed. About half of parents, 50% of parents, are feeling depressed and hopeless, and that fewer than 15% of mothers and 4% of fathers are getting enough sleep. For me personally, what has been hard, especially hard, are the number of times that I thought it was all getting better, that the worst was over. I thought that yes, there's more variants, but I also thought that my family could start to exhale. But that's seen in every horror movie when the main character shoots the bad guy and cries in relief that it's over, and then turns their back on the bad guy, and you yell to yourself, "No, check that he's dead, check that he's dead." We are all that tragic hero, and the coronavirus has gotten right back up again and again. Still now, many of us are feeling like it's getting better and like we're through it. And I think, things are better in many ways. Vaccine has brought a huge relief for parents. Schools and childcare are now open. There is a dropping of mask mandates. Many of us have begun to resume things like socializing, eating out, going to see the CAPS or the NATs in person. But vaccinated people are still getting sick, and adults and kids are still being hospitalized. Kids are still missing school. And, millions of children are still not eligible for a vaccine. And we don't know when they will be or how much of a difference the vaccine is going to make. And all the while, we're sort of waiting for a new variant that may mess it all up again. So let's take kind of a quick look at numbers. And these numbers are important because I think they tell a really important story about the consequences for working mothers in the US. 69% of mothers surveyed have experienced adverse health effects due to worry and stress. Almost 80%, so 8 in 10 of parents of school-aged kids say that uncertainty around school is causing them stress. 66% of mothers with partners say that they are chiefly responsible for childcare, compared to just 24% of fathers. And this one is a big one. Almost 5.5 million payroll jobs have been lost by women since the start of the pandemic. And about a third of women in the age 25 to 44 group say childcare is the reason for that unemployment. Almost half of Black mothers say the pandemic has interfered with their ability to pay for things like food and housing and utilities. And there has been a 9%, this is staggering as well, 9% drop in the labor force participation by single moms, by unpartnered mothers, which is the largest among all of the parent groups. So I think it's safe to say that moms carry the burden. In opposite sex couples, it's mothers who do the majority of the domestic chores and child-related planning, even when both parents work, and the woman is the breadwinner. It's moms who tend to be responsible for the health of their families, the sick days, the doctor's appointments, the worrying about germs, the caring for older relatives. Moms also remain the vast majority of single parents in this country, and some have had the impossible choice in this pandemic between leaving young children at home alone or risking their jobs. Women also make up a high percentage of the industries that have been hardest hit in the pandemic, such as childcare, hospitality, travel. Societal forces are really proving to be as crushing as economic ones. So despite lots of progress, women in 2022 are still expected to shoulder the majority of household duties, including the taking care of the children and the aging parents. And without daycare and in-person education, what was already an impossible or difficult situation really became impossible. And the COVID pandemic has really just exposed this. I think we could all close our eyes and come up with this list of pandemic-related stressors. We all know them, we've been living them. The stress of seeing fewer of our families, travel restrictions, the stress of our loved ones getting sick, losing our loved ones, financial problems, feeling cut off, isolated from our community, from our family, not being able to get food or supplies because of shortages, reduced hours at a job, loss of jobs, difficulty paying rent. We could go on and on. This could go on and on. And so in record numbers, what we know is that Americans are anxious, they're worried, they're sleep deprived, they're distracted, they're depressed. And this sort of triple whammy that we call it of the pandemic, where we have this invisible but omnipresent threat of the virus itself, combined with the disruptions of family daily life, combined with the sort of uncertainty of the future, has really thrust many people, many parents, many mothers into a chronic high stress state. So much is being talked about the mental health pandemic. And while the COVID pandemic itself is really evolving into another stage in the US, at least we hope, the mental health impacts of this trauma is coming into focus, even though the outlook of the long-term psychological effects is really much fuzzier. But much has been reported about this. And in fact, a scientific report by the World Health Organization that came out just last month suggested that there has been a threefold increase in anxiety and depression worldwide since the pandemic began. And what they found is the more of those stressors we just went through, the more likely that people are going to report symptoms of anxiety. And what we also know, and what they also commented on, is a greater burden of negative impact is seen with more vulnerable populations. So we're talking about the elderly, people of color, those with fewest economic resources have been hit the hardest, parents, mothers of color, and specifically women who are pregnant and postpartum are additionally vulnerable. Even under normal circumstances, the perinatal period, which we think of as pregnancy up through the first year postpartum, that perinatal window, is one of enormous change. Biological changes, physiological changes, psychological changes, social changes. And what we know and what we knew before the pandemic was that mental health disorders are the most common complication of the perinatal period. During pregnancy and postpartum, studies estimate pre-pandemic that the prevalence rate of things like major depressive disorder, panic disorder, post-traumatic stress disorder, obsessive compulsive disorder, so the depressive and anxiety disorders, they're called PMADs, perinatal mood and anxiety disorders, that the prevalence rate of these conditions pre-pandemic was about 10 to 20%. So what we're saying is that 1 in 6, 1 in 7 women struggle with anxiety and depression during this period. And according to a host of recent studies, the pandemic is exacerbating those struggles. This one study I'll highlight from Brigham and Women's Hospital in Boston. They did a survey of about 1,100 women early in the pandemic. So the first pandemic summer of 2020. And what they found is over a third had significant levels of depression. And which you can see is significantly higher than pre-pandemic. About 1 in 5 women reported significant levels of anxiety. And it would be interesting to see if this group has resurveyed since to see what the anxiety levels look like. What I'm observing in my clinical practice is that the levels of anxiety are astronomical. And so I would argue that these levels of anxiety are even higher now, 2 years into this pandemic. 1 in 10 had clinical symptoms of post-traumatic stress disorder. And about 9% of the mothers talked about feelings of grief and loss and disappointment relative to their perinatal experience. And the group overall was 5 times more likely to have mental health symptoms, significant mental health symptoms, according to this study. So we know that COVID-19 creates really unique barriers for pregnant and postpartum women that intensifies all of these things that we've been talking about, all of the risk factors for depression and anxiety in mothers, even more so for mothers of color. And so in addition to these universal challenges that we've all experienced, these things like, concerns about being exposed to COVID, concerns about physical distancing recommendations, have sort of an additional challenge, pose an additional challenge for pregnant women. And so I think, Lisa and I have spent much of the last 2 years immersed and working with this population, women who are experiencing a pandemic pregnancy. And what we've seen is it's exacted an enormous toll on women in the last 2 years. And there was a study published in December, so just a few months, maybe 4 months back or so, that really tried to characterize the lived experience of women pregnant with a pandemic pregnancy. And what they revealed were 5 themes. That things like challenges to employment, finances, access to food and transportation, the things that we've talked about earlier, these challenges, they're common pandemic stressors and experiences, but the impact is worse for pregnant women. And so, for example, just to kind of highlight a few things, women who are feeling guilty and afraid, both guilty and afraid about going to work in an environment that may be a higher risk environment, such as, a woman who's pregnant but has a job as a nurse, or has a job as in custodial services at a hospital or a nursing home. Women feeling pressure from within and from without to stop working because they're pregnant and they're in the pandemic, to try to limit their exposure. And then the financial strain that would come with that for women who either decide to stop work or lose their jobs. The challenge to accessing food, especially in the beginning of the pandemic, when we had fears about shopping and bringing food into our home, bringing in groceries, and how that weighed heavier on the minds and hearts of women who were pregnant. Traveling on public transportation, increased stress of the exposure there for women who are pregnant. So kind of all of the things everybody worried about were especially difficult for women in pregnancy. And some of the additional specific worries that another theme were increased worry, uncertainty, and fear. Worry about exposure to the virus, worry about the safety of the vaccine, worry about, changes to the birthing and visitor process at their hospital, worried about being alone when they had their baby, when they birthed their baby. Uncertainty, as the knowledge base about the effects of this virus on a person's health, on a pregnancy, on a baby's health, was not well known in the beginning. And over time, we've learned more and more about that, but that the uncertainty associated with that. Fear, of course, about, getting COVID while pregnant and the impact that would have on them and their babies. There was also enormous amounts of loss expressed, pervasive feelings of loss. That the experience of a pandemic pregnancy is really not in alignment with a woman's hopes and dreams of what a pregnancy is going to look and feel like. Women have lost really like tangible and emotional support. And expectant women are really told to lean in. They're told by Lisa and I to lean into, mom and baby classes, to ask for help, to have people come over and help take care of them and the baby. And suddenly mothers couldn't do any of those things. Many mothers pregnant women described a loss at not being able to celebrate their pregnancy, celebrate their babies, a sadness that the bonding with the extended family would be delayed, separation from their family would just result on missing out on that support that they needed from their mother, their sister, their aunt, their friend, who in other circumstances would be there with them in the weeks and months after they bring a baby home. And then, of course, challenges to accessing care. Care was not, obstetric care itself was not optimal, or has not been optimal, particularly in the beginning of the pandemic. Medical testing has been delayed, leading to lots of anxiety. Appointments are canceled, prenatal visits being canceled because of a woman's potential exposure to COVID, and then going sometimes weeks and months between prenatal visits with her OB, which compromised her prenatal care, compromised the postpartum care, decreased access to breastfeeding supports, other forms of supports, inability to have doula support, doula in the hospital, if that was something that a woman was counting on, planning on. And in addition, I think pregnant women who contract COVID during their pregnancy, we could do a whole hour talking about that, in addition to the terror and the fear they have about the impact of particularly early on when less was known about the impact of COVID on a pregnancy. women felt shame and guilt and embarrassment about being pregnant and having COVID. So Lisa is going to take the baton now and kind of bring some of these themes that we're talking about to life through some case examples.
Thanks, Aimee. Yeah, one of the themes in COVID that we'll come back to towards the end is that it affected everybody very differently, but it affected everybody. And we all know this in our personal life, and as mental health professionals, we know it also at work, that there's people that are suffering with whole ranges of problems associated with COVID. So before I even give you this case example, I'll tell you about my day today, which is my daughter tested positive last night. All my kids are home today. I had reserved 1 hour to give myself lunch and review the slides for this talk, but instead I spent that hour driving them to get PCR tested. I ordered lunch on my phone through Uber Eats, like at red lights on the way back. And I don't know if it was my fault or theirs, but they delivered our lunch and it's all got bacon in it and we're all vegetarians. So we threw our lunch in the trash and my kids are now watching Harry Potter and eating cereal. So that's a day in the life, and none of these were things that are gonna, shut us down. But we all have hundreds of stories like that from the last 2 years. Here are some of the cases that we thought that thank you, Lee, that Aimee and I thought illustrate some of the big themes. So March 2020, beginning of the pandemic, Maya, 39 weeks pregnant with also with twins at home, tests positive for COVID. So the last week of her pregnancy was spent isolated from her partner and her twins, sick with physical symptoms and obviously high levels of stress and anxiety. So this was a pretty common theme. If you were delivering, your partner couldn't come with you into the hospital for much of the pandemic. Even if they were allowed to, if you had kids at home, you weren't getting babysitters, you probably couldn't have the grandparents come watch the kids. So the partner, even during the periods of time they were allowed to come into the hospital, would often have to stay home with the children. And obviously the women who were about to deliver were terrified of being in the hospital and contracting COVID there. Also early in the pandemic, there were stories coming out of New York of hospitals testing women who were there to deliver babies. And if the mothers were positive, they took the babies away from the mothers for 2 weeks. That didn't last long, but it happened at the beginning and was enough to terrify everybody. So in a moment that is already extremely stressful, already a lot of unknowns, already a lot of both logistical and emotional chaos, then there was this whole extra level of fear about COVID and about hospitals and about safety and the inability to have your people around you to support you. Aimee, do you want to forward a slide? A family of 5, 3 children, ages 9, 7, and 2. Mom is a paralegal and dad is a chef. Schools and daycare are closed because of COVID. Dad has been furloughed because he works at a restaurant. Mom had to increase her hours to bring in more money and is working from home. 2 oldest children are at a full-time virtual school, grades 4 and 2, and both need support from mom or dad to fully participate. The 2-year-old requires constant supervision. They live in a small 3-bedroom home with their dog. So the extra burden of people, parents and mostly mothers who had children at home, and the mother was expected to work remotely and the kids were, doing virtual school, but for kids under the age of 10, that required a full-time adult helping them navigate the school schedules, the Zooms, I mean, not even to mention learning anything during this time. I'll add, this was a patient of Aimee's, but I'll add something that somebody said to me at the time, which is that a patient of mine who was working remotely, and the older white the older men in her work environment were constantly talking about how great this pandemic was because everybody had so much free time that they were going to get a lot of extra work done. And the sort of complete unawareness of what this whole time period was like for people that had small kids at home, and mothers in particular who had small kids at home and were doing like triple duty, while these older individuals who didn't have kids in the house were like, yeah, no, now we can like ask you guys to work into the evening and on the weekends because we know that you're not going anywhere or doing anything else. Next slide. Aimee, you want to jump in here? Oh, no, well, I guess.
Sorry, I was muted there, so sorry about that. Yeah, this one, little comic relief, but basically this one really hit home. Teachers, just log on to Zabblezoot, scroll down to Zork app, have the kids work through the assignments sent through Cracklezam, or check the links posted in Drumblekick. Parents. And this is a narrative I heard from a lot of the complaints about from a lot of the mothers that we've worked with who basically became teachers at the same time they were mothers and caregivers, and potentially also doing their the jobs they get paid for. Here's another one that I liked. Good night moon, good night Zoom, good night sense of impending doom. So lots of memes, lots of comedy to help parents move through this piece of it.
Last case, single mother with 8 and 11-year-old kids who works in custodial care at a hospital. Schools are closed, kids in virtual learning, limited social and financial resources require mom to go to work and leave both of the children during day or night shifts. During the day, the kids attend virtual school with no adults at home. The oldest child is looking after the youngest while managing school and frequent check-ins from mom via FaceTime. She was checking in with them via FaceTime throughout the day. Obviously stressing her out with respect to her ability to get her work done and not get in trouble at work, but also keeping an eye on her unsupervised kids. Next slide. So the themes that we sort of put together as we were thinking of the many, many cases that we could present, both of our patients and of our friends, or like, to be honest, we could have just told you stories about ourselves if we wanted to. It wasn't an even playing field for women who work and have children even before COVID, and COVID exacerbated every single asymmetry and unfairness within that. And Aimee showed you statistics of women leaving their jobs or getting fired from their jobs because they couldn't do it at the same time that they were watching kids, or they could do it sometimes, but their kids were in daycare or in school, and sometimes they were there and then things would get shut down, and it was the back and forth that couldn't be managed. Aimee also touched on the idea of the shame. I had a patient who made the decision to put her very small kids in daycare starting summer of 2020 because she would have had to leave her job otherwise. But she felt ashamed of that choice and lived in fear that her kid was going to contract COVID at daycare, and the specific thing she couldn't sort of stop panicking about was having to tell the neighbors that they were a COVID positive house because her child was in daycare. And she said, it makes me feel like when I was in my 20s and you're always worried you're going to contract an STD, and then you're going to have to tell everybody that you've been with that you had this thing happen to you. And the right thing to do is to tell, but it is so shameful. And I think that this has changed over the course of the last 2 years, especially as things have become milder among vaccinated communities. The potential consequences are milder. But certainly in the very beginning, and still to a lesser extent now, it is, people have a sense of shame about it, even in the context of being as careful as you can be. There's also a lot of competition between people about who's making what decisions, how careful to be, and who is being judgy about that in either direction. The complexity of managing multiple family members with different levels of risk, exposure, and vulnerability. So you have a grandparent living with you, or you have a person in the house that has asthma. so they have to be extra careful, but you have another person in the house that goes out of the house for work or for a sport, a kid that goes out of the house for a sport or music lessons, and managing the amount of risk that's coming into your house and the vulnerability of the people in your house is really complicated. We talk about the sandwich generation being the generation of adults that are caring for kids and elderly parents. That was a real, I won't curse, but cluster in COVID, right? Because we're taking care of our kids and for a long time had very little information about how dangerous this was for our kids. But we always knew it was dangerous for our parents. And I don't know about you, I can't control what my dad does, and he wasn't being as safe as I wanted him to be, but I was certainly worrying about it every hour of every day for the first couple of years. For people who have teens in the house, it's already pretty difficult to conceive of risk. And we've seen this in the national conversation with people who say, I did something and I didn't get COVID, and therefore I was not at risk of getting COVID. That's not how risk works, right? But it's a bit of an abstract concept to wrap your mind around. Teenagers are famously poor at assessing risk, right? And so having a teenager in the house who wants to see their friends, who wants to see their girlfriend or boyfriend, who wants to make out with their girlfriend or boyfriend, while you're trying to manage the amount of risk coming into your house is extremely, extremely complex. And as I mentioned, guilt, shame, comparison, and fear of other judgment. So why don't you advance? Okay, so to try to summarize some of the, some of the themes that Aimee and I talk about when we are working with patients around how to articulate some of the dilemmas that we find ourselves in and ways to think about how to solve them. And you know, there's not going to be any absolute answers for any of these things, but frameworks for thinking about how to manage the dilemmas that we find ourselves in. So the first thing to say is put your oxygen mask on first. You've heard this before. We say it, I don't know, every day because people forget, and mothers forget, or forget maybe isn't the right word. There's pretty strong social messaging that we should not be doing this. The social messaging is a good mom is a martyr who puts herself last and takes care of everybody else first. But we all know, both as individuals and certainly as providers, that that's a recipe for burnout and ultimately an inability to care for the people in your care. But when I proposed this to Aimee, she said, okay, but then you're going to tell them what to do, because it's not even clear like what the oxygen mask is in this scenario. And that's the challenge, right? As a mother, as a person, you need to know what you need. And it's not always clear. And if you're not practiced at identifying what it is that you need to stay afloat and then asking for that, it can be really complicated to put your finger on what it is that thing is. Is it time away from the kids? Is it exercise? Is it time with friends, even if in COVID that's on Zoom? Is it taking a walk? Is it, you know, it's a highly individualized thing. What are the things that calm you down when you are feeling overwhelmed? And also there's like the things you need when things are really chaotic, and there are things that you need when things aren't quite as chaotic. But this is a process. This is not like an answer that anybody can hand you, but you have to know what it is that you need when you're starting to feel out of control. And then you have to be willing to make it happen. And if you are the mother who keeps everything running in your house and everybody else assumes that you're the one that's going to get everything done, you know, it's a lot of work to carve out the time to not take care of everyone else and take care of yourself. But it is required. As a caregiver, it is required. One of the things that I like to say in terms of frameworks is that we tend to think of things as zero-sum games. And in our society, we talk about mothering in terms of like, we make sacrifices for the benefit of everybody that we take care of. But relationships don't work like that. So my gain is not your loss. And in fact, in a caretaking relationship, a more apt description is a rising tide lifts all boats, right? When I'm better, I can take better care of I really like this quote from the Dalai Lama, who talks about happiness not as an expectation or a right or a reward. We think about happiness as a reward, but what the Dalai Lama says is that happiness is an obligation that each one of us needs to work towards, because without happiness, you have nothing to give back to humanity. So he makes it a mandate that in order to be a giving, generous person who makes our communities better, we have to first be happy and healthy. Not the way we think about it as Americans so much, but I like that freedom. Aimee, you want to go ahead? So as mental health professionals, we think about this a lot with respect to our patients, and for the people on this call, many of whom are providers of one sort or another. There's you as in your work taking care of people, and then there's you as a parent taking care of your kids. In both senses, COVID's been particularly confusing because we're going through it at the same time as our kids, and we're going through it at the same time as our parents, as our patients and our parents. And we're trying to help everybody else, except that we don't know what we're doing because none of us have been through COVID before. One of the things that that I try to teach when I am teaching therapy is that there's two parts to relating to somebody and taking care of somebody. One is to validate that whatever they're saying is really difficult is actually really difficult. So that's the being with them. That's the, yeah, I can see how incredibly hard that is. And then the other part is the moving forward part. It's the, okay, so like, how do we like put all of that angst a little bit to the side and think more positively about where we want to go? And if you do the like moving forward without doing the validating, then people feel unheard. If you just like sit in the validating, that feels like you're just wallowing without moving forward. And that's what we have to do all the time as therapists. And that's what we have to do as parents too, right? So on the one hand, you're real with your kids. You show your feelings, you explain to them that their feelings are valid and reasonable. And yeah, this is a crazy time. None of us have ever been in this kind of situation before. And yes, it's scary and confusing, and yeah, this is how we all feel. All these feelings make sense. However, as a caretaker, you also have to make sure to do the second part of this, which is, but we are going to be okay. We are going to be fine. We are going to figure this out. And sometimes you have to say that even if you don't totally feel it. And that balance for parents with respect to their kids has been a big theme in our taking care of patients in the last couple of years. Next slide. Lots of people worry about their health even before COVID. With COVID, obviously, it made it more complicated. In general, when you're working with somebody with anxiety about health or anything else, the basic thing to think about is, on the one hand, we cannot pretend that this is a zero risk situation. So if you're particularly freaked out about contracting illnesses or about car crashes or whatever, then the first thing we have to say is, I can't promise you that the risk is zero, but we have to get a reasonable sense of what the risk actually is. And then we have to figure out what things you can do that are the safest possible things so that you can live your life. We have to articulate what you are not doing because of your fear. Now in COVID, we started out not knowing any of that. We didn't know what was safe and what was dangerous. And so we all locked ourselves in our houses. And many communities overdid it with the locking ourselves in the houses to the point of very significant consequences in terms of mental health, in terms of breakdown of social communities and support. So obviously this has gotten a tiny bit easier as we have more hard facts to work with, but we also have to remember that we are balancing the hard facts of what is a COVID risk with the harder to quantify costs and benefits of not taking care of our mental health in terms of being out in the world, in terms of doing activities, in terms of connecting socially. Next slide. Another big theme is the whole comparative guilt theme. Like I shouldn't, I mean, and honestly, like when I was thinking like, oh, I should tell the story of my like crazy day. This is all, you know, very, very mundane things and is predicated on the fact that I'm going to have to eat whatever the cost was of Uber Eats and like whatever. I'm aware that other people have much worse problems than that. And I'm about to tell you cases of people who lost their jobs. And so should I not complain about my crazy morning? And this is something that we all, you know, have to struggle with all the time, but COVID made it harder because it affected every single person in the world. But the range was enormous. I mean, the range was from being shut up in my like, you know, kind of nice house here with my kids and we all get along, and my husband, and we get along enough and we all have computers, as opposed to people who lost their livelihoods or lost their lives. How do you think about that? Again, this is sort of a bigger topic than, you know, you can make into a sound bite, but I think that the main thing to recognize is that sometimes putting things in perspective like that helps us, because it helps us to be like, okay, this is like pretty bad, but, you know, I'm going to also remember to feel grateful that it's not worse and that it is worse for many people. And sometimes we say this to ourselves, it could be worse, and it just makes us feel guilty on top of everything else. Like we're ungrateful and we're complaining. But in fact, we really did have a really, really, really bad day or week or month. And to pretend that we're not allowed to feel bad about that because somebody else has it worse isn't helpful. So one perspective on this, which is obviously a much bigger topic, is just notice when it helps you to remember that other people have it worse, and notice when it doesn't help you that other people have it worse, because you still need to do some amount of, you know, licking your wounds and feeling sorry for yourself for what happened, and requiring the people around you to recognize that what you've been through has been different. I think we have one more slide.
Sorry, there we go.
Oh, I have one more slide, and then Aimee has one more slide, and then we're done. Rule books. This is like universally with new parents. I wish there was a rule book. We're all familiar with this. Like we wish that somebody would just tell us what to do. And what we learn as parents is there is not one rule book, because, you know, if you're going to sleep train your child, how heavy-handed are you going to be with the cry it out strategy versus are you going to just let them sleep with you until they finally don't need to sleep with you in your bed anymore when they're older? There's no one right answer. It depends on your family and your values. With respect to sleep training, what do you care more about? Do you care more about the fact that you're not comfortable letting them cry it out? Or do you care more about the fact that you and your other children need sleep, right? So you have to identify what your values are and what your priorities are, and then you figure out how to work with those. So in COVID, was your priority to keep your risk as low as possible because your daughter has asthma? Or was your priority to keep some regular interactions with people going? Very quickly, we have a neighbor at our summer home in New Jersey who had all of her kids out, her 5 teenagers out, parties and late at night through that first summer. And I was feeling, I will say, very judgy about that. And then encountered her one day outside, and we were chatting, and she started telling me how very terrified she was that her kids were going to get depressed from social isolation, and that she had made a decision that was to accept the risk of COVID in favor of having them be out and socializing, because that felt like the better choice for her. And I don't have to agree with what she decided, but the fact that I can recognize that she was thoughtful about it and she was implementing her values based on what she thought was most important made me, you know, then I don't have to be judgy about it. We figure out our values, she figures out her values. All right. And then Aimee has one last slide.
So we thought it was really important to kind of end this conversation before we discuss and have questions with talking about some of the good that has emerged, because there's no doubt that the pandemic has upended family life for everyone. But amidst all this, I think it can be helpful. It can be a helpful strategy. It can be helpful in the here and now to really reflect on some of the gains, what good things have emerged. And And families got an enormous amount of together time. And by that, I might mean the sort of nuclear family got more together time. There were new families activities that families had to figure out and explore. Our family did a lot more biking and exploring the area that we live on the weekends. And we did a lot more hiking because outdoors activities together seemed safe. And we had lots and lots of time together. Kids also got a chance to learn what parents do for work, particularly for families where both or one parent pivoted and was working from home, that kids got to learn about that and understand what was going on for their parents in different ways. Also, truth be told, and I would raise my hand for this, some kids and parents flourished in the absence of the rigid school schedule. I have 3 daughters, one in particular. I think if she could have stayed there forever, she would have. It turns out I'm not a great 3rd grade teacher, so she went back to school when it opened up, but that she really seemed to do well with that flexibility and that flow. Being able to take breaks when she wants to take breaks, and do her work when she's at her best. Some families also flourished with the pace of family life slowing. Working mothers and fathers, those that work outside the home, could for the first time ever participate in the daily life of their babies and their children in a way that was never possible before the pandemic. Gratitude. And I think this sort of putting things in perspective that Lisa was just talking about, for some people, the time spent appreciating what they had in the face of all this loss was what saw them through it. A redefining of priorities, which I think a lot of families, a lot of people are looking at now. Some things that change, that affect how we do work now, that affect how we do family life now. And that some of those redefining of priorities are actually for the good, for the better. That this, I think, we could say that this was a character building experience. And, that all of us, our kids, ourselves, have become more flexible, have become more adaptable, and have become better able at tolerating uncertainty because we had to. And that will serve us well. That will serve our kids well, having built those character traits. And then, of course, some of the other positives, this expansion of teleworking, which will hopefully benefit all families moving forward, even if it's scaled back, changed, et cetera, that navigating that work-family balance that is such a hard balance to achieve, that telework will hopefully kind of forever be different because of COVID, as will telehealth. And this is something it's transformed how Lisa and I practice. There are women that I've had the opportunity of working with, of treating, of helping in the last 2 years that never would have been able to see me, never would have been able to get the care they needed without the telehealth, which was just fast-tracked and opened up because of COVID. So another beautiful destination, if you will. And then the last kind of piece I wanted to end on before we do questions is this sort of unexpected gift, and it relates to sort of the positive things. This sort of the unexpected gift of stay-at-home orders was time, and that didn't not all parents relished that. Many parents didn't, but I think there were benefits to our kids having time to sleep and think and be, just like in my family. Usually my weekends are cut up by being on sports fields and grocery shopping and being at piano practice or piano recitals. And instead I got to work in the yard a lot. I got to do a lot more cooking, maybe a little more than I would have liked. I got to do a lot more walking. And now that these pandemic restrictions have eased, I personally find myself missing those extra hours. Some of the unstructured time that allowed me and my kids to just wander, sometimes aimlessly. And so I know a lot of mothers like myself, a lot of the mothers I know I work with are really starting to think about ways to hold on to some of those pandemic gifts, the family time, and to try to figure out ways to pull that gift of the experience forward.
Thank you so much. That was wonderful. If everyone go ahead and put questions in the chat. I do see we have one. Before we start that, I just want to put a quick plug in. If you or anyone you know is struggling with these types of issues, the Resiliency and Wellbeing Center is here to help assist you. I will put our website in the chat so you can reach out. There are resources, some of which are specifically to women's well-being, and you can also request a consult with us. So the question, sorry, my screen just changed, is can you recommend a good resource providers like me who are trained as a midwife lactation consultant to help us when we are called to be mental health providers? All my clients who are new parents need some amount of counseling for anxiety, not just breastfeeding tips. And thank you for the presentation.
Aimee, I don't know if you have a great answer to this. I don't have a great answer to this, but Aimee and I are part of a perinatal mental health group that meets, and we have lectures and teach each other. And we had a doula speak to us a couple of months ago, maybe last month. And she said this really profound thing, I thought, which is that her job is like a patchwork quilt. As a doula, her job is to attend to some amount of physical support, some amount of social support, some amount of logistical support, some amount of teaching, and some amount of mental health support. And if she is doing any one of those things more than any other thing, then she's not the person to manage that thing. That part of what she's doing is sort of triaging and identifying that this person needs a specialist in one of these areas, and that her expertise is in seeing the big picture and sort of helping on all of these fronts, but not on any one front too much. And I can imagine as a doula that you have been seeing a lot of extra need in terms of mental health in the last two years. I mean, I'm not surprised, and I'm sure you're being called on to do more than you had, or possibly more than you feel like your training has prepared you for. So personally, if you ever want to give me a call or email me, I'd be very happy to talk to you. But systemically, I think that the answer is to have people on the front lines like you, like doulas, have referral sources so that you know who to send them to as you're identifying greater needs in any of these dimensions.
The only other thing, Lisa, that's brilliant. That's a brilliant answer. And I remember that presentation well too, and loved that analogy that she talked about. The only other piece I might highlight is that, you know, it's hard to get women who need care, anxious moms, connected with therapists. And part of it is they're anxious and overwhelmed. And so making the space in their life to be able to see a therapist is more. It's ultimately a benefit, but it's asking them to do more. And so I think that in your role as a midwife and lactation consultant, that the theme that Lisa talked about, the oxygen mask theme, you know, the rising tide lifts all the boats. That idea is something that I think anyone that works with mothers can kind of tackle that with them, can introduce that idea and tackle that with them and help them identify ways that they can put their own oxygen mask on, that they can kind of, you know, care for themselves, and in doing so, care for the family. And so that would be something that I think in the here and now, working with that theme might give them a start and helping them kind of manage the stress and anxiety that's like right in front of you.
That's wonderful. We are out of time. So thank you all for coming, and thank you very much to our speakers. And we look forward to our next in the Women's Wellbeing Lecture Series.
Thank you so much for having us.
Thank you.
Bye.